GI, a gastroenterologist, oncologist at the Miami Cancer Institute. I treat colorectal cancer, and a lot of my patients are under the age of 50 at time of diagnosis. So with the passing of this Hollywood star of Chadwick Boseman, it really left me with looking at him as a role model to bring awareness to colorectal cancer. All our screening has been geared towards a population age of over 50 years. So in that general population, in the above 50 to about 74 years old, that incidence of colorectal cancer has been decreasing. And that is predominantly because of increasing in screening, which are colonoscopies. The incidence in the age group less than 50 has been increasing. It has increased, I would say, about 13%. So in general, the American Cancer Society in the year 2020 has averaged new diagnosis in the US of colorectal cancer to be about 150,000. 10% are diagnosed before the age of 50. So it can be divided in genetic and non-genetic predisposing risk factors. So the non-genetics would be the obesity, smoking, processed red meats, for example. Smoking also plays a huge risk factor in developing colorectal cancer. If we look at the non-genetics, so the genetic components of increased risk of colorectal cancer, I think the biggest thing to look at is we do have genetic predisposing conditions. The biggest ones are called Lynch syndrome. The other one is called FAP, so familial adenomatous polyposis. If we look at the incidence of this in a younger age group, the biggest telltale sign is speaking to your family, talking to your family, getting that history. If, for example, in the case of Chadwick Boseman, he was diagnosed in 2016 around the age of 39. Because at the age of diagnosis of 39, you would be screened 10 years earlier. So you would be starting to screen at age 29. In light of COVID-19, we urge the general population to adhere to our screening policies. Do not fear to come to the hospital. Hospitals are practicing social distancing. We wear appropriate masks and cleaning policies as well.